There we go. It's 10 o'clock, the 2nd of April. Welcome again, everyone, to today's webinar. We're going to be focusing on navigating pregnancy loss today, and specifically bereavement leave as it applies in the workplace. We're so happy to have you join us, and we hope you will find the next 45 minutes to an hour informative. I'm joined by my colleague Holly today. I'll give her a chance to introduce herself in a tiny bit. And I can see the attendees are still ticking up, so I'll take a chance to set the scene for why we're here. We're going to discuss a development today in the employment law that impacts how employees are supported through pregnancy loss. You may have heard that the Employment Rights Bill, which was introduced in October 2024, has undergone some amendments. And we are going to be discussing the amendments today, which are anticipated to take effect from next year. So it's definitely a step forward in recognizing the emotional and physical impact of pregnancy loss. I think we'll discuss today what it means when an individual goes through pregnancy loss, what it means from a legal standpoint, given these amendments are taking place, and what it means for the workplace. So before we begin, the fun housekeeping points. I'm sure you're all very well versed in webinars now. This webinar is recorded, so if you or your colleague are not able to attend, we can circulate this upon ending. You can use the chat function, which I see you've been using already, so thank you for the positive energy this morning. And you can also ask questions in the Q&A. Be mindful that if you would like your question to be anonymous, just tick the anonymous box so that you're not sharing any identifiable information. And we'll have plenty of time for Q&A, but feel free to put them in the box as we chat. We love webinars to be as conversational as possible. I know this topic can feel a little bit heavy sometimes, but hopefully, we can be as positive about sharing and educating everyone today. So I'm Celine Crawford. I'm your Fertifa co-host for today. I'm the Director of People here at Fertifa. I'm really passionate about building high-performing and inclusive teams. And for me, this really starts with the right support for employees. Like many of us at Fertifa, and I know Holly will share her side as well, I have a personal story with reproductive health. I have gone through pregnancy loss journeys, and I've also been a chief people officer. So you can say that I have quite a unique perspective from an employer and employee and both sides of the reproductive health coin. Holly and I are always very open about our journeys. So I hope you don't mind that we will share a little bit of our personal experience as well, just to add some color as to what might be going through someone's mind and body whilst they're navigating this challenging journey. So before I let Holly introduce herself, I know she's waiting patiently. A little bit about Fertifa. If you're new to Fertifa, we are Europe's most comprehensive reproductive health benefits provider, as well as neurodiversity. We work with global clients from Meta, Sony, Lululemons, and we support their employees through entire reproductive health journey. This goes from fertility, family forming, menopause, men's health, so really end to end. They may come to us for navigational advice, consultations, manager training, or education like today. And I know Holly will share her experience working with patients as well. So we are very excited to have you. And finally, to help us educate on this topic, I'm joined by Holly. Holly is our lead in clinical services today. And over to you, Holly.
Thank you, Celine. And hi, everyone. Thank you so much for joining us today. So as Celine said, I'm Holly Rowland. I'm Head of Clinical Services at Fertifa, and I'm here as co-host just to help guide the conversation on pregnancy loss and how that relates to the bereavement leave law changes that are coming soon. My background is in midwifery and fertility, and over the years I've supported many people through all kinds of pregnancy loss, so miscarriage, stillbirth, termination of medical reasons, perhaps couples that have gone through several rounds of unsuccessful fertility treatment even. But that list is certainly not exhaustive. But beyond sort of my clinical experience, as Celine said, it's something that's very personal to me as well. I've been through pregnancy losses myself, and it's a big part of why I'm so passionate about making sure workplaces offer the right kind of support, both in policy and also in practice as well. It's such an important topic, and I'm really looking forward to sharing some insights, hopefully answering some questions and helping you feel a bit more comfortable in how you can support employees through such a difficult time.
Thanks, Holly. So according to Tommy's, we know that in the UK, 1 in 8 known pregnancies end in pregnancy loss because that actual number is closer to 1 in 4, I think, given that a number of early pregnancy losses within the first 2 4 weeks don't actually get recorded. So it's very significant. Before we dive into the topic, we love data at Fertifa. So I hope you'll indulge us in a little poll before we begin, which I'm launching right now. And you are going to see on your screen a couple of questions. The first question, if you don't mind participating, to give us a sense. Do you currently have a pregnancy loss policy in place? And when we refer to pregnancy loss, in this case, it's before 24 weeks of gestation. Do you currently offer bereavement leave for pregnancy loss? And same again. Thank you so much for voting. I will give it another few seconds. We are at 60% participation, so that's great. I'll give it another couple of seconds. I can see it's still ticking. So what I'm seeing right now is that more than half of you don't currently have a pregnancy loss policy in place. So thank you for being here. Hopefully by the end of the chat, oh, I see some people can't see the poll, which is interesting. I'm sorry about that. I am going to end the poll now. And share the results. Hopefully people can see the results. So where we are at, 56% don't have a pregnancy loss policy. I will share our pregnancy loss policy towards the end of our webinar. So hopefully you can use that as a template. And I can see that almost half do have bereavement leave, which is really great. So thank you for participating. Okay, we can dive in now. I have about 3 or 4 sections in mind. Firstly, we want to discuss the physical and emotional impact pregnancy loss can have on employees. So we'll start with that. We'll talk a bit about the legal ramification, how to set up a pregnancy loss policy, and how to make sure it's accessible and visible. So I'm going to go to you, Holly. Definitions. Let's start with some definitions. Firstly, what do we mean by pregnancy loss?
Perfect. So for the purpose of this webinar, when we're talking about pregnancy loss, we're specifically referring to any loss that happens before 24 weeks of pregnancy. We've chosen to use the term pregnancy loss rather than just miscarriage because miscarriage, while it's the most commonly recognized form of loss, it doesn't fully encompass the range of experiences that people may go through. Miscarriage typically refers to the spontaneous loss of a pregnancy, but there are other situations such as ectopic pregnancy, molar pregnancy, terminations for medical reasons, and unsuccessful embryo transfer after IVF, and I will expand on that in a little bit, that also result in the pregnancy ending before 24 weeks. These experiences can be just as physically and emotionally difficult, and it's important that our language reflects that reality. The reason we've define pregnancy loss this way for today's discussion is that in some places the term is used more broadly to include losses that happen after 24 weeks. However, we've made the decision to separate loss after 24 weeks into a different category and policy, which we can talk a bit more about later. That being said, I think it's important to acknowledge that no matter when pregnancy loss happens, the emotional impact can be just as profound. The grief experienced by someone losing a pregnancy at 10 weeks can be just as intense for someone at 30 weeks, and I've seen that in practice. And that's why having compassionate and well-informed policies in place, whether that's for early pregnancy loss, stillbirth, terminations for medical reasons, is so important in supporting employees. So when we talk about pregnancy loss, it's important to recognize that it's not just a single event. For many people, it's a process, one that can take weeks, sometimes months, both physically and emotionally. It's not as simple as a moment in time where someone loses a pregnancy, recovers, and moves on. The reality of that is that it's far more complex, and for a lot of people, it involves ongoing medical care, repeated hospital visits, and a grieving process that lasts far longer than I think what lots of people expect, particularly if they've not been through that themselves. And when most people hear the term pregnancy loss, they immediately think of miscarriage. And while it is one of the most common types of pregnancy loss as a whole actually includes a range of experiences. So we have early and late miscarriage, but things like molar pregnancy, where normal cells grow instead of a healthy pregnancy. It includes ectopic pregnancy, which happens when a pregnancy develops outside of the uterus and often requires emergency surgery. you've got termination for medical reasons, where someone has to make an incredibly difficult decision to end a pregnancy due to severe abnormalities or risks to their own health. And it even includes experiences that don't always get recognized as loss, like unsuccessful fertility treatment, which can be just as devastating for someone who has invested so much hope in trying to conceive. Each of these experiences is very different, but they all share, one thing in common, and it's that they are both physically and emotionally significant. Physically, the impact of the loss can vary depending on how far someone was into the pregnancy and how that loss was managed as well. So, an early pregnancy loss might be similar to a heavy period for some, but for others, it can involve quite intense cramping, bleeding, and sometimes weeks of symptoms as well. If the pregnancy doesn't resolve naturally, they may need medication to speed things along. And what many people don't realize is that that medication doesn't work instantly. It can cause contractions, it can be very painful, and it doesn't always work the first time either. And if that happens, that person may then need a surgical procedure to help with that. Um, and then there's another thing that's overlooked in that process as well, in that surgery isn't always immediate. It can be a couple of days, maybe even a week sometimes before someone can have that procedure, all the while going through the emotional sort of turbulence of carrying a pregnancy that is no longer viable. Later, oh,
No,
happy
I
to.
was going to say that's a lot of information. So let's unpack a little bit. And you definitely, made me feel a few things. But I remember when I had a molar pregnancy, which by the way, I didn't even know was a thing. So I think like many people who are navigating this, you realize that some things can go wrong as they're happening. So it is helpful to know. It's about wait. You have to wait, a week, 10 days, and it's very traumatic and distressing. So I think you're describing that there's an array of situations that can happen. They won't be the same for any two individuals, and they also won't even be the same for any two pregnancy losses within the same individual as well. So it's important to, have that empathy and support in place to help employees and individuals through that. So thank you for all that. You were about to add something.
I was about to say that as the pregnancy advances as well, often sort of the management for that loss involves things like a labor and delivery, and the after effect of that is that the body responds as though it's just had a baby as well. So things like hormonal changes, even things like milk coming in, and then the risk of things like complications or infections can also kind of prolong that recovery period as well. And I think we've touched briefly on things like molar pregnancy and ectopic pregnancy. Both of these can be quite intense, often involving lots and lots of medical care and repeated appointments. Molar pregnancy can even involve things like chemotherapy sometimes, if the abnormal cells continue to grow. And I think it's just important that we are aware of these different scenarios because I think Celine, you said you're happy to share your experience, and maybe it's a good time to do that. But if someone hasn't been through that or hasn't known someone that's been through that, is something that you maybe haven't heard of before.
Yeah. I think you're absolutely right. And for example, taking a molar pregnancy into consideration, you're right. You have to be testing regularly and taking blood tests to make sure that a specific level of, hormone in your body is decreasing appropriately. Otherwise, absolutely, after a number of weeks and months, you may have to do chemotherapy. So that is very distressing, and people might not realize that you need to take time off work, you need to go do the blood test, you're waiting for the results, you have to get on a call. So it doesn't just end when the pregnancy is lost, even from a physiological standpoint. So absolutely. And then obviously the emotional impact of it is, very, very big.
Yeah, so I think I've only really talked about the physical side of things so far, and I think the grief of pregnancy loss isn't just about losing a baby. It's future hopes and dreams. It's all of that can be taken away very, very quickly. And for many people, they've perhaps not discussed that with anybody because it's still early on, and there is still very much taboo about not talking about early pregnancies and waiting until that 12-week scan. And so much happens before that 12-week scans that you're often kind of dealing with that in isolation. Um, there's also not very widely accepted that there's sort of rituals or there's no sort of funeral, or sort of ways of sort of like having closure on that loss as well. And that can take quite an emotional toll on someone. There's also not a timeline that fits everybody either. Someone might feel okay in the weeks following a loss, but might be hit very hard when they come to a due date or an anniversary of the loss, or it might be that they have, they come across the first pregnancy announcement since they've had that loss, or, attending like a colleague's baby shower, for example. There are lots of different events that may have an effect or may just sort of trigger something in a person that, again, you might just not be thinking about or have thought about if you've not been through that.
Of course. No, thanks for sharing that. I'm just going to pause a second to answer a couple of things that have come in. So, yes, we will email the policy template with the webinar. And if you have to leave this webinar, no problem at all. We will send a recording after this call. So don't worry, just enjoy while you're here. We did have a question about molar pregnancy, so I will put that to you, Holly. So a question around molar pregnancy. So if the woman is getting chemotherapy, that's one of the options that may happen. Would that be classed as cancer essentially, or how would you essentially categorize it?
Okay, so that's a good question. So a molar pregnancy is where the cells in the pregnancy develop much quicker than they would in a normal pregnancy. In some cases, it means that those cells can go on to form a type of cancer. So it's those patients that would essentially end up needing some sort of chemotherapy. Um, whether that's considered part of sort of a pregnancy loss policy or sort of sickness cover would depend on the employer. I think, Selena, would that be fair to say?
Yeah, I think even though it's chemotherapy, and I know when we hear chemotherapy, we think of cancer, I think it's still in the realms of pregnancy loss and dealing with pregnancy rather than cancer specifically, is what I was told when I was going through. I was lucky not to go through treatment, but I know that some people are not so lucky. Cool. All right. So thanks for that, Holly. I think a lot to unpack here. I know it's quite a heavy topic, so we don't want to spend a lot of time, you know, on each of the conditions, etc. Obviously, if you need to find out more, or you'd like to talk to us, there's loads on our education hub as well. You can get in touch with Fertifa. We post a lot on LinkedIn. So we're going to be moving to the topic of today, really, which is around the Employment Rights Bill. So as I was saying in my introduction, it was introduced in October of last year and is currently being reviewed in the House of Lords, including some key amendments relating to pregnancy loss and miscarriage. So the commitment here is to introduce bereavement leave for those affected by a pregnancy loss before 24 weeks. So this is a step forward in recognizing, I guess, the emotional and physical impact of pregnancy loss in the workplace. But what are your thoughts, Holly? 2 weeks, what does that kind of trigger for you?
So I think it's a start. I think it's great that we are finally acknowledging that loss before 24 weeks is loss and it takes time to, whether that's physical or emotional, to recover from that. I think in most cases, I would be surprised if someone was fully recovered from a loss within that time. I think based on the information we've gone through so far, it's very clear that losses and how that's managed can take several weeks sometimes to recover from. And I think it's important that this is just a statutory minimum. And it's worth mentioning that just because that is what's being the legal requirement, or what will be the legal requirement soon, doesn't mean that's all that employers can offer. And I think it's really important to consider, you know, different scenarios that might someone might encounter, and whether or not an employer can sort of support with that as well. But yeah, I think it's a great start. I think it's a fantastic, and we're finally getting somewhere, finally getting some
Yeah.
momentum.
Also, it's important to note that it's unpaid. So,
Yes.
yes, so that is an important consideration. And I think then in the next section, we will talk about, how you can have a discretionary, obviously, pregnancy loss policy and what you can offer throughout. So with the pregnancy loss before 24 weeks, so historically, to confirm, there wasn't any statutory entitlement to maternity, paternity, bereavement leave, etc. We know that if you have a stillbirth after 24 weeks, though, employees are entitled to 52 weeks of maternity leave. Is that correct?
Yeah, so they get the statutory maternity leave and paternity leave, or any other sort of employment policy that they have. They are also entitled to the bereavement leave as well as parental leave. So the sort of, if you imagine someone that's sort of in that sort of 23, 22 weeks even, they don't quite fit into that criteria. So the fact that this is now changing is really important, but there is still lots that we can do to support them. I think that's where us separating our policies into sort of post 24 weeks and before 24 weeks is important, because there's a very different entitlement to those that are past 24 weeks pregnant.
Yeah, I can see some questions coming in. So just to remind people, the legal entitlement, which is not yet in place, but being discussed, is that if you are going through a pregnancy loss before 24 weeks, you would be entitled to 2 weeks bereavement leave unpaid. Correct, Holly?
Yes, that's correct.
And that's just for the mother, or is it both parents?
I believe it's just for the mother at the moment.
Okay.
There is some discussion about whether that would be extended to partners or perhaps surrogates and intended parents as well. I think some aspects are still being discussed, and we'll find out more as that
Yeah,
takes place. But at the
absolutely.
moment,
And that's really important to consider. And we'll spend some time talking about that when we do the next section in a minute around the pregnancy loss policy, because we always urge everyone to consider partners, and we'll discuss why soon. So I did want to add another question from our Q&A. Thank you for all these questions, by the way. They're really great. The government, how do they define pregnancy loss? And specifically, the question is around if someone has a failed round of IVF, for example, does that count as pregnancy loss?
in the plans that have been discussed so far, loss following a fertility treatment, whether that's someone had an embryo transfer and has not had a positive pregnancy test, that was to be included in that. And I think that's why it's been important to kind of discuss those different losses that we perhaps haven't considered so far. It can be just as devastating to have another negative pregnancy test following an IVF cycle as it is losing a pregnancy later on. So again, fantastic that that is being considered.
Yeah. I did have someone point out that if there's actually the birth of a baby before 24 weeks and they were breathing on their own, that they would be entitled to maternity leave. Obviously, we're getting into edge cases now. We don't want to generalize, but obviously that's a situation where it would be quite different.
Yeah, there is in the UK, there is a sort of a grey area of legality around sort of that crossover between sort of 22, 23 weeks pregnancy and sort of the legal definition of viability at 24 weeks as well. So I'm sorry, I didn't see the question come in, but that person is correct. In some cases, if you are just on that cusp of 24 weeks, it may be considered that
Yeah.
that is no longer a early pregnancy loss. It's considered a neonatal death.
Yeah, absolutely. Thank you for that. We're getting some really great comments actually in the chat, which are being sent to us. So I think people are sharing their experiences, and I'm very sorry for everyone who's, sharing that they've suffered a loss, and specifically, the lack of understanding around the emotional impact of such a loss, which I know we completely agree with, and the narrative that's, even though of course absolutely rightly should focus on the female journey, should also take into account other partners, which could be male, could be other females if it's a same-sex couple, or two males essentially. So completely agree with that. And I think we hope by having these conversations that we can further the understanding that all parties involved should be considered, including the surrogates that are going through potentially surrogacy, for example. So I'm just mindful of time. We are 25 past. I want to discuss policies. I think sometimes, there's a lot of recommendations of things that we can do. And a policy is a really good place to start if you're not sure where. So I do invite people to at least think about having a policy. I know more than half of attendees did not have one in place, and that's absolutely fine. I think sometimes people worry to get it wrong, but we always say you need to get it wrong to get it right. And hopefully our template is a good step for that. So discussing a pregnancy loss policy, let's discuss, I guess, what are the important things to consider in terms of leave, but also let's go through other things that might be important that people might be looking for. So, from your perspective, Holly, I know you speak to patients, you speak to couples, you speak to different types of modern families. What is it that people need when they're going through such a challenge?
I think it's, worth with all the different experiences that someone can go through. I think it's very important to factor in that everyone will need different things. It's very difficult to implement a one size fits all policy, which I think is a tendency with workplace policies, particularly in sort of larger companies where it's very difficult to kind of do a one, in a very tailored plan each time. I think it's worth thinking about how much leave will be offered. Will you be matching the legal minimum? Do we want to go a bit further than that? Do we want to provide a flexible return to work policy? Do you want to do sort of like an individual one-to-one plan with these employees when they return to work? Thinking about who will be covered. Will you be extending it to partners, whether or not the statutory law, that law will change to include partners or not? Will you do that as an employer? Will you think about intended parents, so those that are using a surrogate but aren't actually pregnant themselves, the surrogate themselves, if you have a surrogate that's working for you, and even those that have experienced unsuccessful fertility treatment. I think it's also important to create a culture where employees can feel like they can use that policy as well. It's only policies, they can be fantastic, but they're only as good as sort of like the culture that's within that company as well. Does someone feel comfortable asking for that? Is it easy to find that policy without them having to approach someone that they maybe don't know in the HR team? It's really important. And then I think on top of that, it's whether or not you also support for things like counselling services, mental health support. There's really sort of lots of different things to consider. And, I think it's being open to, an employee perhaps asking for some support, somewhere that you haven't considered as well, and whether that would be something that you'd be open to as well.
Yeah, absolutely. These are all important suggestions. So, just to recap a little bit. So, first of all, we really advise people to be as clear as possible around the leave offered. And even if it's a case of saying there is no leave offered or, just the legal minimum, then at least it helps people understand what they can use and what they have to be able to book time off. Should they be using their annual leave if that's the case, which obviously we do not recommend at Vertifa. So it's very, very important to be clear. I think the second thing is around confidentiality. I think sometimes there's a worry that people want to be anonymous, rightly so. They don't want to share what's going on with them. Other people may be quite comfortable sharing. Personally, I had two opposing experiences, one where I was completely in silent and in the background, and another where actually I felt quite empowered to let people know that this is something I was going through. So don't assume that you know what someone might need, but do think about all the eventualities. Um, when we talk about leave, I think we discussed that, leave for partners is absolutely crucial. Partners going through this are going through immense grief. We know grief doesn't follow office hours. It's very, very helpful to know what is at the disposal of people. Maybe they can work from home to support their partner to go for appointments. Maybe they can start a bit later and finish later. Whatever that may be, open the conversation and create a safe space for people to be able to go and find those questions and ask those questions. So I cannot stress this enough. Partners are, someone's rock as well going through this, and they need a rock because they're going through it as well. And I think often, well, we're not there yet in terms of normalizing that. So I do want to make sure that you include partners in your policies. And when I share the template, you will see that we have done that. We have mentioned the pregnancy loss policy before 24 weeks and the one after 24 weeks. Again, we always urge people to have flexibility and empathy. If you have someone who has lost you know, a pregnancy at 23 weeks and then suddenly they don't qualify for what comes after 24 weeks, that might feel unfair. So you really want to think about having a flexible policy that has some clarity as to the leave, but also gives some amount of leeway to cater for individual cases and case by case cases. And I think this is where you discuss the personal plan, which is something that we recommend as well. And it's about the trifecta of, the employee, the manager, and the people team or the HR team. As long as there's the working together of these three individuals. And sometimes it might be the case that, you don't have a great manager or you don't feel so close to your HR person. That's fine. As long as you have one person that can help you put together a plan, I think that's really helpful. And to review that plan, right? You may have gone through the loss, you think you have closure, you feel fine, and then a month down the line, you're feeling really unwell, whether it's physically or emotionally. There should be an option for people to open that discussion and get the support. Do you want to add anything to that? I guess in terms of, creating a positive culture, how can companies ensure, I think you said that the policy is not just there, but that it's lived. What are some of the things that companies can do to make sure that people are confident and able to use the policy?
I think it's around sort of not making it a taboo subject. I think, it's important that we have these conversations, whether we do sort of like I mean, at Fatifa, we have sort of like wider company conversations about things like this that happen. And as a company, we generally feel quite comfortable discussing these sorts of topics, even though they are quite difficult. And I know I can't speak for everybody on that. And I know there will always be a scenario where someone perhaps needs a little bit more support, maybe from an individual person, as opposed to sort of just speaking widely about something. I think it's important to highlight the support that FATIFA can give in employers and employees as well. So companies that use FATIFA, their employees can come to us and we can provide that support, whether that's signposting to sort of support networks, whether it's finding mental health support for them, whether it's just talking through what's happened to them and sort of providing a bit more support, reassurance, whatever that may be. We have the sort of the clinical skill set to provide that support. um we've also supported with sort of like manager training as well sometimes as well.
Yep.
Again, it's important that as a manager or a HR individual that you feel comfortable having those discussions as well. You don't want to be kind of put in that
Yeah.
conversation, not really feel
Yeah.
that.
Super. So there's a couple of questions in the chat about, how do you have a policy that's individual, but also, obviously you need to have some sort of a general policy, right? So just to answer that question quickly, what we recommend, first of all, is to have clarity as to the minimum that you're offering. So, and we do stress that we think it should be equal leave for all involved. So whether surrogate, single parent, individuals, all parties should have equal leave. And then once that leave has been used or the individual may need something more, just to have that flexibility to have those conversations around an additional plan. And again, we said this might not always be leave that they need. They might need more flexibility in terms of how they're working. Let's say if they're presenting lots of webinars like we are today, they might not want to do webinars. So it might be small adjustments in their day-to-day work and not always about the intended leave. So I think that's a really good question. Something I did want to ask you, Holly, and that we get asked a lot is why isn't the pregnancy loss policy just part of, the maternity, paternity policy, and why should it be its own policy?
So this was a discussion that we had with our ERG, where we kind of discussed with the team who had various experiences about, what they felt was most appropriate for them if they were going through that now at this point. We felt that the sort of the legal entitlement for someone post 24 weeks was very, very different for those pre 24 weeks. And we found that those in the ERG felt that they didn't want to be scrolling through a huge document that talked about maternity leave policies, and we didn't want to be talking about paternity leave policies. And it was just, you wanted a very kind of, you didn't have to go through lots of different policies to find the right one either. So it was very important to us as a group that we had one that was very easy to find, very clearly outlined, and just very sort of simplified in terms of what it was that we'd be entitled to and how to access that support. It can often be quite triggering in itself, having to find, what I would have been entitled to had I had a baby at term. So we felt that that was the most important thing. Yeah.
No, absolutely. Completely agree with that. We have a really good question in the chat about essentially the time frame, and I think this speaks to like the discretion of employers, but should there be a time frame where people should be using their leave? Should it be 6 months, 12 months? I mean, I know what I think, but before I say, what do you think, Holly? Should there be a time frame?
I think, yeah, yes, but I think it would have to be a very broad timeline from my experience. Um, Thinking about due dates and anniversaries of that loss can be very, very difficult for people. Again, I can't speak for everybody, but knowing my own experiences there, that can be quite tricky. Um, so yeah, I think it's up to the employer, obviously, but I
Yeah.
think a broader timeline, if you're going to implement one, would be most beneficial to your.
Absolutely. I completely agree with that. And so I think it is important in the policy to clarify whether the leave is continuous or not. I think it's very helpful to have the option of taking non-continuous leave, meaning you can take it in chunks as and when you need it. Yeah, that's what I would say from my own experience, but also from a workplace point of view. Okay, great. So I want to touch on a couple more things, and then we will open it up to the Q&A, and I will share our template, which please download and share. We want to spread this as far and wide as possible. So we talked about having a pregnancy loss policy. Obviously, we at Fertifa help individuals, going through pregnancy loss. From your point of view as the head of the clinical services and speaking to patients, what does that look like when someone has access to Fertifa or other providers like Fertifa? What can they get from Fertifa that maybe goes beyond just having a policy?
It's the clinical knowledge, I think, that can be super super helpful. I think you know most patients going through anything like this will be going through the NHS if they're a UK employee. Um, Unfortunately, I think we all understand that there are some limitations with the NHS in terms of the support that's able to provide, maybe the wait times. Um, if you have an employee that has perhaps been told that she has lost a pregnancy, but has to wait a week before she can have any more sort of support with that, you've got this sort of period of being in limbo where you don't really have access to anybody, you can't get an appointment with your GP. It's very, very difficult. And then so being able to access sort of support with us, whether that's just with messaging, so it might be that they're up at 2 o'clock in the morning having a really bad time and they just feel like they need to get some thoughts out, they can send that message to us and we'll be there in the morning ready and waiting to answer that question. They can book in discovery calls and have an actual physical person there talking to them, and which is really important. They just feel that they're listened to. I think we can check in with them in a couple of weeks' time. It might be that they had an important milestone coming up. We have that. We know that we can check in with them. We can offer that support on for as long as they need, which is not something they would necessarily get through their own healthcare provider or even through their employer sometimes as well.
Yeah, absolutely. Because I remember when I had my molar pregnancy, before I knew what it was, actually you get a scan, but then they have to read the scan and interpret it. So it's so helpful to have someone to, it's not really put your mind at ease because obviously you don't want to get that information, but there is some, I guess, control and help in knowing what's going on with you so that you can try and prepare for it in the best way possible and get the information.
Absolutely. And again, my own personal experiences, I've been working in this industry for a very long time, and even knowing that I had to go for a scan and then wait for the results and being told nothing at that scan until I then had my follow-up with my GP much later, and then had my routine checkup with my GP months after that. So, it's just that those periods of limbo where you just don't really have enough support, and that's where we come in.
Yeah, absolutely. So I will share the policy in the chat now. Let me know if you're able to download it, and please do. But yeah, if there's any issues, do let me know so that we can change the link if that's the case. All right, so our closing conversation is really to hone in on tips around opening workplace conversation. So we always say lead by example, and having obviously leadership buy-in is very helpful. Making sure that your policy is easy to find. Let's discuss the role as fertility officer. I think you recently had a webinar with Natalie Sutherland, who was actually the first fertility officer in the UK. So what is the fertility officer, and how can organizations do something similar?
Okay, so I think there's a bit of scope to kind of make a fertility officer what you want it. And I think essentially it's just a champion within the workplace. That is someone that maybe has had their own experiences or just a bit of I guess a passion to create that environment where they are kind of starting those conversations. They're maybe having sort of lunch meetings and kind of creating almost a workforce that is a bit more knowledgeable, has a bit more understanding, and just creating that environment where other employees feel a bit more supported. They're thinking about the policy. Is it up to date? Is it what we need? Are they getting feedback from people that have perhaps used the policy as well? And just making sure that it is fit for purpose and kind of feeding that back to the representatives in the company that sort of
Yeah.
make change.
And I think often if you do have a fertility officer, you do tend to have an ERG, so an employee resource group, because it does galvanize people to talk about a specific topic. And I think that's really positive because I have had the experience of being a champion, but or having someone a champion, but if that person says leave the company, then suddenly you have a big gap as to, support and help in a specific area. So it is a very good idea to have ERGs as well. We had our own for pregnancy loss and for doing the policies, and we always gather feedback and kind of learn from all perspectives. So definitely recommend that. Let's touch on manager training. I think some of the things we hear a lot about people and we help, our clients with is training managers. I think it can be overwhelming as a manager to have to answer questions around topics that you are not well versed in. You're afraid to say the wrong thing. You try to be empathetic, or maybe someone just doesn't get it. So how does that work? And how can managers do more in terms of helping people on their teams?
So, I think it's fair to say that all managers want to be supportive of their employees. But I think especially with situations like this, it's quite difficult to know what to say and how to approach these situations. And I think that's why we think that the manager training is important, because it should be a dedicated independent session, and somewhere that they can ask questions and to someone that understands and knows, but also where they can gain the confidence in handling those sensitive conversations as well. So that's where we can help with that. We can help, whether it's education around the different types of loss and what that means and what those timelines look like, and kind of go in a bit more depth with that. We can talk about some of the experiences that somebody may be happening, sort of more like the emotional side of things as well, because we know that takes its toll, possibly for a bit longer, even than the physical side of things. And it's just supporting leaders understanding how to have the discussions with empathy, without making assumptions as well. I think that's important.
Yeah, absolutely. So the final thing that I would recommend to include in policies is signposting to support organizations, to charities like Tommy's, for example, the Miscarriage Association. That is a really great website, especially for people who are not sure how to respond to someone who comes to you and says, I've had a loss. I think there are some really great tips on there. So do include those in the policy, because not everybody will want to come and speak. And so it's important to think of the different methods for different types of individuals that might want to get the information by, doing their research or following these links. Are there any others that you recommend?
I think for me, Tommy's and the Miscarriage Association are way up there in terms of support. But you also have SANDS, so SANDS, which is another really valuable source of support as well. Maybe more geared towards slightly later loss than the pregnancy.
Yeah, absolutely. Okay, so before we open it up to the Q&A, and I can see there's quite a few questions, if you will agree a final poll, and then we will jump in. Actually, I can't. Oh, here we are. Sorry. So I'm just launching the poll now. I'm not going to share the result. Obviously, this is just for you to do in your own time. So we had a few questions come in, and I think one was very important, and it's around the government in terms of evidence. So, for example, if someone has gone through a pregnancy loss, do they have to provide evidence that they had a pregnancy? How does that work in practice?
So I think in some circumstances there will be, just because of how the healthcare system works, there will be some evidence of pregnancy. But I think that's quite difficult in some situations, particularly in early pregnancies, where individuals haven't maybe been to the GP or haven't had their first booking appointment with their midwife. So there would be no evidence besides perhaps a positive pregnancy test. So I don't I don't think evidence will be required. Um, we don't, in the UK, there's no such thing as death certificates or anything like that for a pregnancy loss. So there would be nothing sort of formal to kind of say that someone has been through this. Again, I don't think it's necessarily something that you would need to ask for within a policy.
Yeah, no, absolutely. I agree. I
Don't
think
tend
you can get a miscarriage certificate now, which
to can, yeah.
we also, if you download the template, there should be a link to that. Sometimes people like to have that as
Mhm.
sort of acknowledgement of what they're gone through. I did get another question just to clarify the legal framework, so I will repeat. So historically, there's been no entitlement to maternity, paternity, or any bereavement leave for miscarriages or pregnancy loss occurring before 24 weeks. Now, the amendment proposed is to have 2 weeks of unpaid bereavement leave for the mother only so far. Just to clarify that this has not passed yet and is likely to be enacted from, I think, Q1 of 2026. So, we're a bit ahead of the conversations, and I'm sure they will discuss the different clarifications again. When we will do the follow-up email, I can see some questions around, the signposting, etc. If you download our template, there will be loads of links to the websites that we mentioned and that we recommend. There will also be definitions. And when we do our follow-up email, you will get a webinar recording, you will get the template again, and we will signpost again. So please don't worry. Okay, so I'm conscious of the time. It's 1:45. I want to be respectful of everyone's time. We've had some really wonderful questions. If you want to type a question to Holly or to myself or to anyone here, please feel free to pop it in the Q&A box or in the chat, and then we can discuss it. Someone has asked about champion training. Do we provide champion training? I think yes. This is part of the training, whether it's ERG, champion manager. We provide all kinds of training. So we're always happy to talk all things training and policies. And I'm just going to give it another second. I'm going through all these questions. I think we've answered a lot. Of these, actually. If we've missed your questions, many apologies, but I think we have covered quite a few. So unless there are any more questions, I want to thank everybody for coming. Thank you for your participation. We actually had loads of messages to the hosts and panelists, loads of questions. Thank you for, I guess, propagating this topic and for joining the Fertifa webinar. And yes, we look forward to seeing you at our next webinar. And we're always here if you have any questions. So have a lovely rest of your day, everybody. Thank you.
Thank you.